Welcome everyone, I'm Anne Livingston and I'll be the Chair and Moderator for today's webinar presented by Community Resourcing. Today's session, using technologies for dementia care in the home, is part of a series being hosted by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. The Community Care Smart Assistive Technology Collaborative has been funded by the Queensland Government to link providers of community care on issues relating to incorporating smart assistive technology in service delivery. Today's session will be delivered by Dr. Carrie Peterson. Carrie has a PhD and degrees in human services, psychology, gerontology, and her PhD thesis was in engineering and was on the quality of life and technology in dementia care. Carrie has a very varied experience being a volunteer, a private carer, having worked in day centre programs, hospice and in research for over the past 30 years. Carrie's current work focuses on innovation in dementia care, and she's working to develop and evaluate the health and social care services for people and families living with dementia. It's my pleasure to welcome Carrie to today's webinar.
Thank you, Anne. Hi, everyone. Welcome to this webinar on technologies in dementia care, and thank you for joining. I'm Carrie Peterson. I'm a gerontologist, and I completed my PhD on technologies and quality of life in dementia care in 2014. I've had a lifelong passion for improving the lives of aging adults, and I've been working with dementia since 2004. Back then, I wasn't interested in technology for aging, or gerontechnology. But after moving to Denmark, I started to think about what the future of dementia care was going to be, which is why I pursued my PhD in the topic. I was really surprised and inspired by working with the engineers about how quickly technology is progressing and how many services could be applied to dementia care. I hope that you find this webinar informative and that it gets you excited about the possibilities of using technology as well. I won't be going into the techie side of the technologies, but focus on practical examples. So let's get started. Well, technology basically means the creation or use of technical means for practical purposes. In this way, we can understand technology to be both low-tech and high-tech. Low-tech interventions include things you probably already use, such as handrails, walking aids, and shower chairs. This webinar doesn't focus on these types of technologies, but on the high-tech interventions that may be less well known. Some commonly used high-tech interventions that we'll discuss today include communication technologies that allow for connecting with others, sharing information, and to communicate about the environment, such as real-time alarms and access to telecare networks. Mobile devices are getting smarter and cheaper every day. Using a phone, tablet, or other mobile technology allows us to connect to the internet and access information when we're on the go. Sensors can monitor and collect data. Sensors are getting smarter and smaller. These can be placed anywhere in the home to sense temperature, humidity, movement, and so on. There are also sensors which can be worn on the body to detect heart rate, blood pressure, breathing, location, and even infection. Home automation technologies are used to automatically control basic home functions and features. Smart homes use automation to ensure safety and to make the home an easier environment to live in. Things like turning off the lights when no one is in a room and automatically lock and unlock doors. Robotic technologies are increasingly popular and can perform domestic services like a robotic vacuum, assistance with transferring and toileting, or companionship activities like robotic pets. Advances in the field of robotics are making great strides in incorporating affective computing so that the robots can detect human affect or emotions through facial and body language, and they will have the capability to adapt to the individual's mood. Together, these elements are helping to shape a new era of home-based care through access to services and new methods to provide care. This has vast implications in dementia, as technology is a great complement to the demand for intuitive, personalized care. We'll get back to some more examples of technology, but first let's talk a bit about why you would use technology in dementia care. A very short answer is this: it serves a purpose. Technology is not intended to replace human contact or human care practices, but to support them. Think of the goal of using technology as absorbing some of your care management tasks so that you can focus on what you do best, which is provide the human touch of compassionate care. It may meet a need that isn't being met by other methods. It may offer a new way of providing care through easier management. It may give you peace of mind to know you'll be alerted as soon as something goes wrong, or nearly any other purpose you can imagine. But the real benefit of using technology in dementia care is that it has meaning for you or the person you care about. Just as with other aspects of dementia care, one strategy won't work for all people all the time, and you'll need to find out what's going to be best for your situation. I'll give you some tips and considerations later on to help you find out what the real meaning might be for you. In the more general sense, research shows that carers will be most interested in technology that will support them in delivering, monitoring, tracking, and coordinating care. Research shows that the most important benefits that technology provides to carers are in saving time, easing care logistics, safety, increasing feelings of effective caregiving, and in reducing stress. Anyone involved in the safety and care of an individual with dementia can use technology. One strategy is to support care by transferring tasks from the individual to the telecare system. And there really is something valuable to this. After all, as much as we love the people in our lives, we can't be there for them around the clock. Technology, on the other hand, with its always-on nature, can be. Now let's look a bit further at what the research says about the benefits of using these types of technologies. So research shows that a range of long-term services that are adaptable to address the emotional, physical, and mental stresses of dementia care are needed. Care services will be most supportive when they're tailored to the unique challenges of dementia and recognize that the dementia experience is different when compared to other types of care. But what does this mean when we break it down into strategies we can use? Well, it means that multi-component interventions will be more effective in relieving stress than interventions that have narrow strategies and goals. Interventions aimed at individual carers and their families, including the person with dementia, are more likely to relieve carer stress than those targeted just at carers. And allowing users to co-create the interventions by identifying problems to be addressed, the methods to address them, and the timing and frequency of the interventions will be more likely to achieve desired outcomes than interventions that are fixed in terms of what, how, and when they're delivered. One study used focus groups of carers for people with dementia to find out what they thought of the technology and how they could incorporate this into their care plans. The researchers found that the technology can support independence and increase quality of life, delay or defer institutionalization, and promote safety. However, they were concerned that the technology could oversimplify tasks and weaken intact abilities, what we call learned dependence, and that there is a stigma of visible technologies, especially among younger adults with dementia. Another study looked at commercial monitoring systems in the homes of 14 adults with dementia over a period of 9 months. The researchers found that there was improved safety and security, reductions in carer stress, financial benefits, and that an early warning system can promote aging in place. In my PhD research, we tested smart home dementia care systems in 4 European countries. The family carers reported that the largest impact they noticed was reassurance for the safety of their person. This was done by being able to check the activities in the home, know the location when they're outside of the home, receive notifications for unusual events, and easy contact through a button on a touchscreen computer. The reminders, calendar, GPS tracking, home activities monitoring, and easy contact button were rated most positively. The reminder service was one of the most used in this study, and it was easy for the family carers and the community care workers to adjust. Some of the families even reported that the individual with dementia was more likely to listen to a third-person reminder than to the family carers, which helped reduce aggressiveness and improve their relationships. There were difficulties as well, including false scares. When using a new system, there may be technical bugs to work out, internet connectivity issues to be resolved, and the system may need to learn more about the home before being able to determine a normal versus a non-normal event. It can be frightening to get emergency text messages through the night. One example of this in our project was that family members were getting text messages during the night that the person with dementia had pressed the emergency contact button on the touchscreen computer. They would check in and no one had pressed the button. We eventually found out that there were these small black insects that were attracted to the light, and they crawled behind the computer screen, and they were activating the button. So we fixed this by making the touch screen less sensitive to light or touches. In another example, some of the people with dementia would press the emergency contact button when they were showing the system to their friends. It was their way of showing how good the system was because they would get a phone call right after they pressed the button. The technology in my research project brought the psychological benefits of reduced stress, reduced anxiety and worry, and brought peace of mind. The family carers had positive reviews, stating that they felt that their quality of life improved, that the quality of life of the person with dementia improved, independent living improved, home safety improved, care responsibilities decreased, and nearly 90% were satisfied with the services. The community care workers reported that the home technology system improved and supported the independence in daily life for the people with dementia, and it had even more benefits for the family carers. They reported that everyone seemed to feel safer and less anxious, emphasizing that the family carers were more aware of and reassured about the home situation through the monitoring, and this helped to reduce the stress. When looking at research on technologies in dementia care, it's important to keep in mind that no two people with dementia are the same, have the same functioning level, same needs, or same care situation. There are also many ways to measure quality of life, life satisfaction, and care benefits. These make it very hard to decisively conclude one way or another about technology in dementia care. Just as with other interventions, no technology will work for everyone, and it's likely that it will need to be adjusted as the dementia progresses. So now that you've heard a little bit about the research, let's get into some practical examples of these technologies that are available today. Technology can connect people involved in the care of an individual, allow communication with the person with dementia and their family, as well as coordination with other care providers. Improved care coordination will help with discharges and smoother transitions from one care setting to another, coordinating services like transportation and meal delivery, engaging and empowering patients and families, and allow for better preparing, planning, and streamlining of patient services. On the personal side, there are apps and service platforms that make it easier for one person to manage their own schedule or appointments or tasks, or these can be shared with and assigned to others who are also involved. Technology may not make family members or friends help out more, but it can keep them up to date on the person with dementia status and activities. It also lets them know what they could help out with if they would like to be more involved. Technologies used for safety are those that allow you to manage safety issues and receive notifications for unsafe situations. You can monitor activities in the home like cooking, movement within the home, and get early warnings on dangerous situations. Technology can be used at entryways and exits to detect when someone is entering or leaving the home. There are motion detectors, which are often coupled with notification services so that family carers are notified when doors and windows are used. Software and services can send medication reminders, and pill dispensers can monitor to help make sure that the correct medications are taken at the right time. They can also warn of missed medications, remind users to refill prescriptions, and in case of repeated missed medications, alert family members or care providers to take action. There are also flood detectors in case water should be left running, and temperature regulators to prevent scalding and burning from showers or sinks. In my PhD project, we used a cooker sensor, and we had one woman with dementia request that she get a notification if she had left the cooker on because she wanted to resolve any home issues herself if she could. We could easily accommodate this and support her independence, and we kept the function that if she still did not turn off the cooker, it would automatically turn off and the notification would be removed from her reminders. Technology can be used to monitor how often the refrigerator door is opened, which can also help to determine if a person is eating regular meals. In another example from my research, we had one son that noticed his mother wasn't cooking meals during the week like she said she was, and that she was losing weight. He used the system to send daily reminders to her to make lunches and dinners, and she started to put weight back on. Motion sensors can detect if someone is in a room or passing down the hallway and can automatically turn lights on, which can help with wayfinding and to prevent falls in the dark. If you have pets in the home, be sure to move the motion sensors high enough to avoid detecting them. There are some fall detection services which create a pressure grid on the floor, and they can look at only the shape of the body, so not see the face or the body parts. And this can be used to detect if a person has fallen and then contact help automatically. Another commonly used technology is to monitor sound in the bedroom, much like baby monitors. These can be used to listen to breathing and if the person is awake and asking for help. Pressure sensors can detect if a person is in the bed or a chair, as well as how long they've been there and how restful they have been. Changes in sleep patterns can also help you to know if there's a change in health status and if they should be reevaluated by their doctor. These pressure sensors can notify family carers or direct care workers if someone has been in bed too long and needs to be checked on, or if they've not been in bed long enough during the night. A bed sensor could help you sleep better because you know you will be notified if they get out of bed during the night. I have a short story as an example. One woman in the smart home study that I worked on was living alone, and her daughter lived several kilometers away. One night, the daughter received a text message from the system saying that her mother had been out of bed for too long. In the morning, the daughter called the mother's house, and there was no answer, so she drove over to check on the situation before going to work. Her mother had fallen during the night and was on the floor next to the bed. Luckily, she wasn't seriously hurt and had only been on the floor for a few hours. The daughter was glad the system had alerted her, otherwise her mother may have laid on the floor all day. Before we move on from safety, there's one more aspect I'd like to cover, because safety isn't just for the person with dementia. As I mentioned, we're seeing more robotic technology used in health and social care. Here are a few examples of where they're great to use. So here you see a robot that's transferring a person to the bed. As you're probably aware, this is an activity that can be hard on the back and is one specific task that can easily cause injury if not done properly. Another example involving the bed is this motorized turning sheet. It's by a Danish company called Vendlet, which means turn easy, and it's available in Australia. It works by the sheet slowly and gently moving from one of the motorized bars to the other, all with the touch of a button. This means that only one person is needed for repositioning and that they can focus on the person lying down, a great example of letting technology absorb the task so the human can focus on compassion. Another example of robotics is this toilet, and I wanted to include this because toileting can be quite a sensitive care task for everyone involved. These toilets can have sensors to warm the seat to body temperature so there isn't the shock of a cold seat in the middle of the night. It can have a warm bidet and a warm air dryer. This eliminates the need to come in physical contact with waste and can reduce infection. They also have a tilting seat which can make it easier to sit down and stand up. It gives more independence and dignity during this sensitive activity. And now I'd like to take a few minutes to talk specifically about location tracking. So technology can also support care outside of the home, and most of us have heard of GPS tracking for people with dementia. The wearables for GPS are changing all the time, and now you can get tracking devices that look more like jewelry and less like technology. Another great feature is when they have geofencing. And geofencing is a software that creates a virtual fence around a geographical area, or a safe zone. So, for example, a person is safe to walk alone, and the family sets up a geofence so that the safe walking area is within a radius of 2 kilometers. If the person goes outside the safe area, family members are contacted so that they can intervene. It's a good solution to maximize independence and still keep an eye on their location. In the project that I was working on, the people with dementia reported that the GPS gave them more independence because they could resume taking walks again, go to the store, or go to social events alone. And they felt safer because they knew they would be helped if they would get confused or lost. What was surprising was how the community care workers and family carers used the GPS system. So the community care workers would check the person's location before they would drive out to make their visit. This is especially used when care workers would have to drive considerable distances to visit the clients. They often had full schedules, so it was beneficial for them to make sure that the person was at home. It also allowed that the person with dementia could carry out their daily activities as it suited them, rather than having to plan their day around visitors. The family members would check on the person's location throughout the day and see if they were at the memory cafe, having coffee at a neighbor's, or taking a walk. They would also use the GPS system to see if the person was at home if no one answered the phone. They felt better having a general idea of the person's location and activities during the day. Social and emotional connections and support are very important in dementia care as well. Online platforms allow for the person with dementia and their carers to connect with family, friends, social groups, and support circles. It's also possible to get a mentor or counseling through technology. In fact, psychology is one branch of healthcare that's quite successful in using teleservices. You can connect with a dementia coach or a psychologist to get emotional support and advice without leaving your home and at all hours of the day or night. Some good examples of where to find people to connect with and share experiences online are care groups through dementia associations, Facebook has social groups, and the websites that you see here. You can also go online and find groups that meet up in person. Technology can be used to support the physical health of an individual. Some apps and websites can support proper nutrition and hydration, provide dietary information, and encourage exercise for both the brain and the body. There are also some robotic tools to assist with eating and drinking, like the liftware spoon pictured here. This utensil works by counteracting shaking, like you would see in Parkinson's, so that food doesn't spill off. One trend that I find exciting is the use of technology in rehabilitation. This can be a great option if the person has mobility issues which make it difficult for them to get out of the house and go to the training center, or if they live in remote areas where it's difficult for the rehab specialist to make home visits. Another added benefit is that the technology can capture information that greatly helps in the rehab process, like duration of exercises, how quickly the person fatigues, if exercises are being done correctly, or if there are other issues that might otherwise be missed. Researchers are also working on shoe-based or wearable gait sensors that can recommend rehabilitation strategies to prevent falls. These can also be used to monitor a host of medical conditions that affect mobility, like diabetic neuropathy, ataxia, rheumatoid arthritis, and Huntington's disease. There are many apps that are great communication aids, like the food choice picture shown here. This can help a person with dementia to have more of a say in their food choices. This one is actually an autism communicator, but many of the tools that are useful with autism are also useful with dementia. So I don't think that many of us will be surprised to hear that carers look for dementia-related information on the internet. You can look up specific health conditions, guidelines for care practices, advice, research articles, local services, and so on. While this isn't groundbreaking news, it does show us a few things. One is that carers are already using technology to support their dementia care, and the second is that there's a need for continued education in this area. Family carers can even get online coaching through services like the Alzheimer's Association website. A wonderful advancement in dementia education that I'm seeing is in massive open online courses called MOOCs. These are courses that are offered online for free and are great resources for learning more about many of the aspects of dementia. So now let's talk about some of the things you should consider when deciding to use a new technology. What is most important when deciding if and which technology to use is that it meets a need and that it fits into a person's life. First, let's look at how to decide if the technology is appropriate by going over some issues to think about. These tips and considerations will help you to decide which services would give the most meaning for you. What is the current stage of dementia? It's challenging for people with dementia to use technologies that are new to them, particularly if they're interactive devices. Some services that are appropriate for an individual in the early stages of dementia won't be appropriate for those in the later stages. For example, the reminder service can be helpful in the early to middle stages and would become less useful as the dementia progresses. Another issue to keep in mind is that you want to avoid technology fully taking over actions or responsibilities, especially for the person with dementia. If you want the technology to support them in carrying out activities, but not do it completely for them. Otherwise, they risk losing abilities that they do already have and learning to be helpless and dependent on the technology when they actually are able. Whenever possible, see if you can use a new technology on a trial basis to be sure it's useful and usable for the person. What are the current areas of difficulty, and what are the things that are causing stress? Do you have trouble sleeping at night because you're worried that your person is getting up and moving around? Does your person with dementia have difficulty sleeping? It's not uncommon that people with dementia will awaken and start cooking during the night. And whether it's day or night, if you're concerned about cooking habits or fires in the home, it would be worth your while to look into cooker monitors, which can automatically turn off the stove or oven if it's been left on for too long, or they can be set to not turn on at all if it's the middle of the night. Is the person with dementia leaving the home alone? Having a door monitor that alerts you when the door is open can be a good idea. In one study that I was involved in, a woman with dementia left her house in the middle of the night, and her daughter, who did not live with her, was notified right away by text message. This was in Finland in the winter, when it's very cold and dangerous to be outside. Her daughter drove over and found her mother walking down the street in her pajamas, and was able to get her home safely, all in less than 30 minutes. If the person is in the milder stages of dementia and is safe to leave the home alone, it would still be a good idea to consider using a GPS tracker. This will help with the family care's peace of mind and make it easier to find the person if they should need help or if they've been gone for too long. Are falls a concern? You may want to consider sensors that can detect falls and alert carers and emergency services. Another consideration to take into account is if you live with the person or if you're caring from a distance. If you live locally, using the telecare system can mean that you can check the activities and status of the person with dementia from your computer, rather than needing to stop over to check in. If you don't live close enough for regular visits, being able to see the activities in the home, the cooking and sleeping patterns, and having another set of electronic eyes on your loved one will keep you informed about what their daily life looks like. You can stay informed about doctor visits, changes in status, and who's regularly in contact with your loved one. You can coordinate with other family, friends, and neighbors to check in on them. They can drive them to appointments, and they can also help keep you updated. In another study I was involved in, we had one son who used to drive 15 kilometers a day to check on his mother. Now that he could see her activities through the platform and receive notifications if anything was wrong, he no longer needed to drive over every day after work. He could also enjoy his time with his mother more socially, as he already knew what was going on in the home. The son said he hadn't realized how stressed he was and how stressed the driving was making him until after they had used the technology. What are the goals of using technology as part of the care plan? Is it to coordinate care with the direct care workers or with the family carers? Is the goal to monitor what happens in the home? Is it to prevent home safety issues? Do you want the technology to provide some form of entertainment? It's important to list what you want to get from using the technology, not only so you have a clear idea of what you would be willing to purchase or use, but also so that those who provide the technology and services can better match what they offer with what you need. So now that you have an idea of the stage of dementia, the difficult areas that could be supported, and some goals for what you would like the technology to do, it's time to look at what the service would require of you. This includes some of the technical requirements as well as personal competencies. So do you need a stable internet connection? There's mountainous and rural areas that may not have a stable enough connection, and some services will require internet connection while other services won't. Will you need a mobile phone, a smartphone with a data plan, a tablet, or a computer to use the service? Do you already use these, or will you need to purchase them? Are you willing to learn to use a new service, or would you rather have a solution where you don't need to learn how to use a new device? Will you need a subscription? Some services require that you have a monthly or even yearly subscription to use their service. Will the person with dementia need to interact with the technology, and are they able to do this? How can the service be adapted to the person when they no longer interact with the technology? And it's important to look at what the technology or service provider will also offer you. So who installs the system? Is customer support offered? Who do you call for assistance? It's great if they offer customer support. Even if you're a tech whiz, if something's not working and you're frazzled, let someone who knows what to do solve any issues. The point of getting the technology is to support the dementia care you're involved in, so don't make it harder on yourself than you need to. You have your job, and the support team has their job. An extra bonus is if they come out to do training and will automatically update the system for you. If you're talking with a service provider, ask about these options. They want you to succeed, and they want you to have as positive of an experience as possible with their product. Does their technology connect with other technology that you already have or that you will use, something that we call interoperability? It's great if the service that they're offering works with what you already have available. It's also a good idea to ask the service provider if they're currently reworking whatever service it is you want to purchase. It may be that they're going to come out with a newer version in a few months, and you would want to consider purchasing now, waiting, or asking them about free upgrades. Affordability is also a concern. We've already mentioned some cost-related things to consider, like if there's a monthly service fee and if you need to purchase additional equipment like a new phone or computer. When you contact a service provider, it's important to ask about the purchasing price and if there's any additional monthly, yearly, or maintenance fees. Once you have an idea of what the service will cost, don't panic. Take some time to think about what this service really provides for you and what the alternatives could cost. If using new technology can help prevent a fire and needing to move into a new home, the cost is relatively small in comparison. If new technology could help with medication management or support proper nutrition and avoid visits to the doctor or hospitalization, it starts to seem more affordable by saving time and money. It may also be that using new technology can help you sleep better at night, have more peace of mind, and help someone to feel safer and more independent. These are hard to put a price on, so you need to consider if these are worth the cost for you in your care situation. A simplified way to think about if the cost is worth it is to consider what this new service will save you. Will it keep you from needing to hire in-home help? Will it keep someone out of the hospital? Will it delay or defer moving into a nursing home? So on. In my research, where we created the smart home system, we offered around 15 services, ranging from increased contact through the touchscreen computer, to an intelligent front door, to cooker monitors, to medication reminders. We found that the overall installation and startup cost of the system was an average of 5,000 Australian dollars per person and around 90,000 Australian dollars for the regional health and social care providers. 90% of the family carers and people with dementia said they were willing to use a system like this, and over half of them said they'd be willing to pay for the services. In comparison, 1 year of nursing home placement in Australia costs an average of $48,000, and the average cost of a single hospitalization episode for some with dementia is around $7,000. So even our complex smart home system with a wide range of devices and services costs less than one hospital stay. We also found that the regional care providers benefited from the telecare through increased efficiency in information collection, improved billing processes, increased management capacities, more convenience, faster accessibility, and resource savings for the care professionals. So now that we've covered why, how, and where people use technologies in dementia care, we've seen some examples, and we've considered a few things to help us decide which technology could work best for us. Where can we find these technologies? Well, instead of cramming a bunch of web links onto the next few slides, I've compiled a list of places where you can find these and other technologies, including service providers and organizations in Australia. These will be available as an extra PDF file you can download from community resources. There are many, many technologies available on the market, and more are added each day. The examples given today provide a good starting point, and this webinar also comes with some good resources if you want to look around a bit more. For many carers, being supported through co-creating and tailoring the services is a great benefit, and they can be further supported by enhancing the methods they already find effective. In the future, I foresee that telecare interventions will not only be aimed at decline, such as reduced eyesight or mobility, but also aimed at improving coping behaviors, such as task-focused activities and management strategies. Improvements in personal and microcomputers, such as wearable technologies and embedded biosensing devices, these are going to extend the care context outside of the home. Devices are increasingly connected to each other, allowing communication over large networks and enabling individuals to interact with their community in new ways, such as we're seeing in the emergence of smart cities. At the end of the day, technology needs to be useful. If no one's using it, it's certainly not going to be useful. So it's absolutely important to remember that the main goals are that it serves a purpose and fits into their life. We need to listen to the people with dementia and their carers to be sure that they're on board with using any new care method and that we're serving them by meeting their needs. I hope this webinar was informative and exciting for you. Thank you for participating. So these are some of the scientific articles and the information that I used when compiling this webinar. This information will be useful for you if you want to read a bit more about the development of these types of technologies. And then also, as I mentioned, I've compiled a PDF that has a bunch of information on service providers and places where you can go to purchase these technologies, and that will be available on the community resourcing website. So again, I thank you for your attention, and I'll turn it over to Anne for questions and answers.
Thank you, Carrie, for a fantastic webinar. You've covered a range of issues that I'm sure will be interest to community care providers. Now, I have a number of questions that have come in from people who have been listening to this webinar, and in three in particular I'd like to give you to address. I've got an email from Fiona in a remote community, and Fiona says, thanks Carrie for a very informative webinar. We're a small size community care provider, but we have an emphasis on providing programs to family caregivers and particularly to support family carers. We haven't incorporated any smart assistive technology before in our service delivery. The choices you outlined are many, and we're trying to make our first step into incorporating technology as easy as possible. Do you have any suggestions?
Okay, well, it's great that you're interested in incorporating these technologies, because I really think that they're going to be more prevalent in dementia care and in many aspects of health and social care in the future. So great that you're planning to do this. So maybe a first step is thinking about what types of support programs that you offer to the family carers. If you are wanting to recommend technologies to them, something like the Lively smart home monitoring, it's a bunch of different sensors that you can place around the home. You can place them on the refrigerator, on the stove, on medications, and they register when someone is using any of these things. So you can get an idea of how often they're leaving the home or how often they're cooking or taking their medication. And this is a service that doesn't require internet access. It costs about $35 a month. It's very easy to use. That might be something you might want to recommend. If you're thinking of something at your own facility or your own center that you have, a good idea would be something with the care coordination that we had in the slides, so you can easier communicate with family carers or care providers, and you can coordinate services and who's involved in the care of a person. So that might be a good place to start.
Thank you, Carrie. That's great information. I've got another question from Peter, who's a care coordinator. Peter said the issue of privacy and information sharing has been at the forefront of our minds as you delivered this webinar. Are you able to give us your comments on this, Dr. Peterson? We're particularly interested in how, as a community care service provider, we can get the information we require, but also maintain privacy for the individual.
Yeah, this is a really important question and kind of a hot topic, especially when we talk about the monitoring systems and GPS tracking devices. So one of the first questions you want to ask is how much information will be shared with the service provider? Who will be receiving the notifications or messages? Is it the family or is it community care workers? Can you limit the information that other people like family members see? What will the doctors receive? You want to consider some of those things when you're looking at a service. Several studies that I've looked at show that people are comfortable sharing private information if it provides them with better care, helps them to feel safer, and gives them more independence. So it's a trade-off, and you want to ask the person with dementia first, if you can, what they feel comfortable with. If they're able to understand and give consent, that is great. Talk with them, find out how they feel. If not, find out who has the decision-making authority, and you kind of need to take it on a case-by-case basis. So try and involve the person with dementia as much as you can if they have the capacity. And if not, talk with the caregivers and find out exactly what information will be shared and how you could limit that.
Thank you very much. I've got one last question. This is from Carolyn. Carolyn works at a large service provider in Australia, and she indicates that it's been an excellent presentation and you've provided her with some great information to think about in their community care service delivery. She asked, do you have any comments how best we might prepare the workforces that work for us to incorporate smart assistive technology?
Yeah, that's a good question. Um, so a great way to start is through education. Start by having them listen to this webinar and get an idea for what types of technologies are available and how they might be used. It's always better if you can get people inspired and excited about the work that they're doing rather than giving them a bunch of new technology and saying, here, you have to learn how to do this. So investing in online or ongoing training and support is a great way of accomplishing this. It's great also if it comes with on-site support staff, which can come in and train the care workers themselves, so that you don't have to take over this responsibility yourself. It's also a really great idea if you can get one kind of champion or cheerleader involved who's going to really make efforts to motivate others and find out if there's any issues and then figure out a way to resolve them from the inside.
That's great, Carrie. Thank you very much for your time on today's webinar. On behalf of the members of the Community Care Smart Assistive Technology Collaborative, I'd like to thank you for your time and sharing your expertise. We look forward to seeing some more of your work and your research endeavours on our Smart Assistive Technology Collaborative, and we look forward to liaising with you on other webinars. Thank you.
Thank you. Me too.